Hello, my name is Madison Vachara-Borntafon, and I'll be going over autoimmune hemolytic anemia, also known as AIHA. So what is this disease? AIHA occurs when one's immune system mistakes red blood cells as unwanted substances. This leads to antibodies being produced to destroy red blood cells, which leads to anemia. When suffering from anemia, there are not enough red blood cells to carry oxygen throughout the body, which can lead to a variety of different symptoms, which we will soon go over. Although this disease sounds troubling, it's extremely rare and affects 1 to 2 people out of 100,000 a year, and it's most commonly found in females over the age of 40. Although this condition is highly manageable, it can be fatal if left untreated. So there are two different types of AIHA. Regarding the warm one, it's the most common type of AIHA as it affects 80 to 90% of cases. So this happens when the person's body temperature is normal. So it involves IgG antibodies, and these bind to the red blood cells at normal body temperature. The cause for this disease is unknown, but it can be secondary to already existing conditions such as lupus, chronic infections, or medications. The cold version is more rare as it affects 10 to 20% of cases, and it involves IgM antibodies rather than IgG. These bind to the red blood cells when the body is exposed to colder temperatures, usually 39 degrees or less. The cause for this disease can be idiopathic or due to secondary reasons such as infections as well. So regarding the warm version of AIHA, IgG antibodies bind to the surface of the red blood cells at normal body temperature. The red blood cells coated in IgG are marked for opsonization and can possibly even activate C3. As these red blood cells travel through the spleen, macrophages recognize either the C3b on the red blood cell or the Fc region of the antibody. These macrophages then engulf either part or all of the red blood cell, which causes the cell to break down. Regarding the cold version of AIHA, this usually happens at temperatures below 39. So the IgM antibodies bind to the antigens on the red blood cell surface. The IgM then activates the classical complement pathway, which deposits C3b onto the red blood cells. As the temperature rises, the IgM antibody disconnects from the red blood cell, but the C3b remains attached. As these red blood cells coated in the C3b pass through the liver, they're removed by macrophages. Something else that can happen but is more rare is when the complement goes to C5 to C9, which forms the membrane attack complex and eventually leads to cell lysis. So some symptoms, they're kind of the same, but there's little differences between the warm and cold. So for warm, they'll usually experience pale or yellowing skin due to all these effects happening in the liver. They'll experience tiredness, dizziness, heart palpitations, dark urine, shortness of breath, or an enlarged spleen and liver, once again due to the reactions happening in those organs. For the cold version of AIHA, they'll also experience tiredness and dizziness, but they'll also experience cold hands and feet, pain in the chest and back of legs, vomiting and diarrhea, pain and blue coloring of hands and feet, and heart issues such as murmurs, arrhythmias, and heart failure. And they usually have pain and blue coloring in the hands and feet because that's where blood circulation is a little less, and that's where most of the reactions are happening. So some treatments, they do differ as well. So for the warm version of AIHA, it typically responds better to immunosuppressants, so doctors will prescribe corticosteroids, which suppress IgG antibody production, and this is especially helpful because IgG is what kills the blood in the first place. They'll also prescribe rituximab, and this targets B cells that produce antibodies. For the cold AIHA, it's usually less responsive to immunosuppressants, so doctors typically urge patients to avoid cold and dress warmly as much as they can. But they also will prescribe rituximab just to see if they respond to it well. And general for both of them, if their condition is very severe, they could do blood transfusions or even surgery such as splenectomies in order to remove the site of red blood cell destruction. Here is my works cited, and thank you for watching.